Good day all. My name is Tarini King George and my metric number is 188717. Today I would like to demonstrate on how to perform physical examination on your little furry one. Meet Chocolate. She is a 2 years old domestic short-haired cat managed indoor, vaccinated and dewormed, and she has been fed with kibbles. So in order for us to begin the physical examination, the first step we have to do is the general examination. General examination can be done from the head until to the tail, and I would like to begin from the head. So we have to look whether the head is symmetry or no, and then we have to evaluate whether is there any head tilt. Moving on to the eye, we have to look for is there any discharges, protrusion of third eyelid, swollen eye or cloudy eye. And eventually to the nose, we have to see is there any blockage, is there any bleeding, discharges. Discharges could be could be either unilateral or bilateral, and the discharges could be either serous discharge, serous sanguineous, mucopurulent, mucoid, or even blood, which is known as epistaxis. Moving on to the examination to the ear of the ear. So we have to look into the ear using the pen light and look for is there any debris, and also we have to palpate the ear canal externally and look is there any pain shown. Moving on to the oral cavity, so we have to observe externally the lips, is there any injury, any swollen, and then we have to examine the oral cavity, look for is there any ulcers, and also evaluate the mucous membrane, look for the color of the mucous membrane and also the CRT. In the normal setting, the cat should have CRT which is less than 2 seconds. Then following that, we have to palpate the lymph nodes. So here I'm palpating the submandibular lymph nodes. The lymph node should be easily movable, small, and it's not bulged, and both sides should have an equal size. And then we have to examine the prescapular lymph node. And eventually we have to palpate the forelimb to look for is there any fracture, any joint abnormalities, is there any pain shown. This has to be done equally in both forelimbs, both right and left. And moving on, we have to palpate the abdomen. Help me to restrain. Okay, thank you. We have to palpate the abdomen, look for is there any subcutaneous mass, and by doing this we have to place our stethoscope at the point of elbow, left side, for us to take the heart rate. Look for the lung sound, whether it's normal or is there any breathing abnormalities. Then we can palpate the bladder over here. Then we have to palpate the hind limb as well, same with the forelimb. Look for is there any fracture. Also finally we have to palpate the tail. And once we done all of this, then only we have to insert our thermometer with KY jelly on top of it into the rectal wall, and make sure we have to place the thermometer at the rectal wall, near to the rectal wall, and not at the feces, because it can accidentally take the temperature of the feces instead of the body temperature. This step has been done at the last because we want to reduce the stress in the patient. Also we have to check the perianal area to look for is there any discharges, any abnormalities, and then we have to evaluate the skin tone to look for the dehydration status. So that's all from me. Thank you.